I see Jenny virtually. Jenny, if you would like to start, that'd be great.
Thank you, Chair Munoz, Vice Chair Elmer, Representative Nelson, and members of the committee. My name is Jenny Olson, and I'm president of AFSCME Local 328 at OHSU, and I'm a Grants and Contracts Administrator in the Office of Proposal and Award Management, and I've been at OHSU for over 10 years. I'm grateful to have the opportunity to offer testimony in support of House Bill 2792. At OHSU, every job plays a crucial role in the well-being and health outcomes of our patients. As the president of Local 328, representing over 8,500 members, I speak on behalf of a diverse group of workers. Each is vital to our patients' experience. From food service workers who nourish our patients and their families, to maintenance and custodial staff who ensure a clean, safe, and functional environment for healing, administrative professionals who facilitate access to health care, secure necessary funding, and ensure compliance and training standards are upheld, to direct patient care providers who deliver bedside care with compassion and expertise. Every worker in our university hospital contributes to the positive health outcomes of those we serve. With the weight of such responsibility on our shoulders, our workers will not take the decision to strike lightly. We understand that a strike would impact not only our own lives, but more importantly, it would affect the patients that we care for and their families and truly touch the heart of our community. Our decision to call for a strike would only be made with the utmost consideration for what is best for our patients and our community. Our workers do not want to strike, ever. They are dedicated to providing care, and they understand that their time is precious, not for their own benefit, but for the well-being of our patients. Our workers will not strike unless the issues at hand are truly dire and no other option remains. If a strike happens, it will be to address critical issues in the workplace, like understaffing, unsafe working conditions, and the need for livable wages so that our members can survive in a city where the cost of living is rising. House Bill 2792 will serve as a platform for trust between Oregon hospitals, the community, and the state. This bill will ensure that taxpayer dollars are being spent with the best interests of our community in mind. Funding for our hospitals should be directed toward meeting the health needs of our community. By investing in the wages and benefits of its workers, OHSU and other Oregon hospitals will ensure that patients receive the best care possible, that staffing levels remain safe, and that working conditions promote the highest quality of care. When funding intended for patient care and staffing is instead redirected to pay for strike replacements, most of whom are not residents of our states, the priorities shift away from patient care and community well-being toward corporate profits. Bargaining in good faith is an investment, and while it can be costly, it pales in comparison to the expense of temporary replacement workers. The employer bets big on long-term savings, but that gamble is made at the expense of the health and well-being of our community. Unfortunately, that bet doesn't often pay off. Ultimately, the cost to long-term safety and sustainability of patient care will need to be paid. Our money should be spent wisely to support our community, invest in our workers, and ensure that the health and safety of our patients and families come first. I believe House Bill 2792 will serve as a critical bridge in resolving labor disputes and will build a lasting bond of trust between our hospitals and the communities we serve. It will ensure that the resources entrusted to OHSU and all Oregon hospitals are used to protect the health, safety, and welfare of our patients, families, and those who rely on us. And if I may say, earlier, the question was asked, what is the purpose of this bill? And to me, the purpose of this bill is to ensure that there is fair bargaining. It truly, as a taxpayer, I want to know how my money is being spent and making sure that it's spent wisely and investing into the people who are already caring for the patients who need it. Thank you.